Hey everyone, good afternoon and Merry Christmas Eve to everybody out there. Thank you for tuning in for our COVID update. This should be a relatively quick one and you can get back to your last minute shopping like I am doing today. On a more serious note, as we head into the holidays, I just really want to encourage everyone to please, in the spirit of the holidays, think of each other, take care of each other, do everything we can to protect each other. This has been a really tough month of December. As I talked about in my last update, we've now had 31 fatalities in Ulster County this month alone, and of course the month isn't yet done. So please be safe heading into this holiday week coming up here between Christmas and New Year's. We are possibly starting to see the slowing or the flattening a little bit, and that is encouraging. And the last thing that we want to do is see that ramp back up again in response to Christmas gatherings. We think much of the momentum of the second wave was really built around initially Halloween gatherings and then very much accelerated by Thanksgiving gatherings and get-togethers of small groups, often family, and that is what has resulted now in these tragic losses in the last week or two. And so as we head into this holiday period, please think and plan and adjust accordingly. I know it's not what any of us imagined at the beginning of this year or want to do, but it's what's really called for at this point, given that we know how this will play out if we don't follow those precautions. I think at the end of the day, when we talk about numbers, we talk about statistics, we talk about different rates and infection rates and restrictions. It's really simple. Our goal for all of us is to make it through this winter without losing any more of our family members, our loved ones, our friends, our neighbors, our colleagues. That's a simple, understandable goal, and we know how to do that. And we know that there are vaccines coming and already actually starting here, and more coming, and we'll talk about that. So please keep that in mind as you make your plans. I know for us it's going to be a much more low-key and maybe a little more boring Christmas, but that is okay. In terms of the numbers and the statistics, we are now approaching 5,500 cumulative total cases since the beginning of the pandemic, 5,486 in Ulster County to be exact. Total tests, 187,000 plus, 3,345 recovered. We have started to see our recovery numbers grow now from the Thanksgiving wave, which is good news, of course. A lot more recovery is now into the triple digits each day, but we did have one more fatality in the last 48 hours since our last update, bringing us to 132 lives lost. And again, just as a reminder for those that didn't tune in on Tuesday, at the beginning of December, we were at 101. So just in this month alone, we've lost 31 Ulster County residents, and that is just, especially in the holiday season, just absolutely heartbreaking. Hospitalizations are holding steady, which is good news. We're at 21, again, hospitalized. We did see a few more move into the ICU, 4 now in ICU beds in Ulster County. You can see a potential slight decrease there on the graph, and we hope that we can continue that downward trend, or at least holding steady on hospitalizations in Ulster County. Active cases, also some sign for encouragement here. Because of the recovery rate picking up, we are, again, right around 2,000 total active cases. We're concerned that we're still seeing anywhere in the ballpark of 60, 70, or even 100 plus new cases per day, but we are seeing now a little bit more of a catch-up in terms of the recovery rate, as those that got sick are recovering and getting better and getting through their quarantine periods. So that has allowed us to, for the last week or so, stay right around 2,000 total active cases. Remember, that's confirmed active cases that we know about. It's almost certain that there are significantly more out there that we're not detecting because folks aren't testing or may not even be symptomatic. The new positive case rate, which continues to be an important metric to understand how rapidly COVID is spreading and how widespread it is, that is very much still a data point of concern for us. In the last 48 hours, we have tested 2,573 residents, and of those, 201 were positive. So for the 48-hour period, that puts us at a 7.8% new infection rate. Yesterday, actually, we had 115 new cases and set an all-time high for this second wave, near 10% new infection rate. So we are still seeing a very concerningly high number of new positives out of those being tested. That means that we are still, we think, in a community spread sort of a situation. So once again, factoring that into your holiday plans, that means as much as you want to get together with an extended family or some friends and neighbors, and as much as you love them and you trust them and you want to give them the benefit of the doubt, it's highly likely that folks out there are positive and may not know it. Either they're pre-symptomatic, asymptomatic, and we saw so many of those, and we did, through our contact tracing, discover so many of those types of situations around Halloween and Thanksgiving. So please, again, really work to avoid those social gatherings, which is a big ask, I know, but I wouldn't be making the ask if I didn't think it made the difference between life and death for some of our residents in the county. In terms of our total projections looking forward, you can see here on the graph our sort of best, middle, and worst case, pretty much the same as last time, putting us somewhere between 6,000 to 8,000 total cumulative cases by the end of the calendar year, by the end of the month of December. Hospital capacity. This is an area that is very important that we continue to watch, and right now we feel good about. Although we have 21 hospitalized and 4 in the ICU, we maintain more than adequate capacity, both in beds and staff, to be able to meet additional need if that arises. This is, as we've heard Governor Cuomo, I think, rightly talk about, this is the most important metric in terms of any decisions related to restrictions on businesses or other closures or restrictions. If we get to a point where we think that COVID is so bad that we might once again overrun hospital capacity, that's where we'd look ahead and say, if that's coming a few weeks out, then we would put in place additional restrictions. Right now, we are not at that point in Ulster County or in the region. And I think all of our goal, for a bunch of reasons, is to keep it that way. So that is another reason and incentive for all of us to continue to follow the precautions. In addition to avoiding those social gatherings, and if you absolutely have to get together, to make sure that you wear masks, maintain distance, wash hands after. We now know definitively how this thing spreads, and we know how effective masks are. We know that being indoors in particular is much more risky than being outdoors. So, you know, if you feel like you absolutely have to see the extended family, getting together outdoors even briefly and keeping that distance is a much better option than all packing into your living room, especially for an enduring period of time. So once again, let the science guide us in that regard, and not just when you're out in public, but really when you're interacting with anybody at this point, given community spread. Please remember masks, social distancing, and hand washing. And to everybody that's doing that, which is 99+% of folks, thank you, and please continue a few more months here till we get to what we're going to talk about next, which is our vaccination distribution plan. The more that the planning happens around this, and I had another very, very good and detailed call this morning with all of our regions leaders and healthcare leaders, the more the planning happens, the more optimistic and hopeful I feel that we really have a good plan, that we have a clear light that we're working towards at the end of the tunnel of this winter. And I'm going to talk a little bit more about what we know there. This is very much a moving process. We're planning rapidly. We're planning through the holidays. We'll continue to be on calls and submitting information and working this through collectively, and know that we're all not resting until we have this planned right and executed properly. I continue to feel that the vaccine distribution, making sure that it's rapid and safe and equitable, is the single most important and the most complex undertaking of our entire pandemic response. And so we are resourcing it as such and treating it with that seriousness. The governor announced these regional vaccine distribution hubs. We, of course, are in the Mid-Hudson Valley region, made up of 7 counties. Had, as I said, another call this morning with all the county leaders and healthcare leaders, and we'll also be broadening that task force with other critical community leaders from really replicating kind of the same that we set up here in the county with our vaccine distribution coalition. That planning continues and is going well. In terms of what's happening, we are now well into phase 1 out of 5 phases of the vaccine distribution plan. Phase 1 includes healthcare workers, especially those in patient care settings like the ICU and our emergency rooms, as well as our EMS workers. It also includes our senior facilities and other long-term care facilities. Both of those are now happening. Earlier this week, we started with our first senior facilities in Ulster County, and that will continue throughout this month and into next month. We're also continuing to give vaccines to our healthcare workers, including now both the Pfizer and the Moderna vaccines are on the ground now here in Ulster County and being delivered. The advantage, of course, of the Moderna vaccine is that the refrigeration and deep freeze requirements are less, so that makes it easier to get it out to more places, which is good news for our efforts. The next big hurdle, or the next big phase, it's not really a hurdle, but the next big part of vaccine distribution will be phase 2. That's where we'll broaden out and really focus on our frontline workers, first responders, teachers and school staff, public health workers, really anybody that's regularly interacting with the public and has to be regularly interacting with the public because they are considered an essential worker, like pharmacists, grocery store workers, transit employees, and we'll continue to work through also our long-term care facility population. That is a much more complex undertaking, but I think the good news is we're learning a lot in this phase 1. It's going well. We are improving the process as we go, and I think we'll be in a very good place probably come, we think, mid to late January to begin moving into phase 2. And then, of course, phases 3, 4, and 5 we'll get to as quickly as we can. The real limiting factor at this point continues to be availability of the vaccine, which is still very, very limited. We're still at the point in Ulster County where we're well below 1,000 total vaccines given. We're really in the hundreds still of total residents that have received the vaccine within that phase 1 category. The majority of our planning effort now is work to identify and finalize our what are called, this is a new acronym we'll all get familiar with, POD sites, P-O-D, point of distribution. Those are the places across the county where we'll be distributing the vaccine to the general population, whether that's a doctor's office, a hospital, or a county-run site across the county. And we're finalizing that planning effort of where those will be. And as soon as we know all those details and have them finalized and approved through the regional hub and the state, we'll be sharing that as soon as we possibly can with everybody. The other important aspect, of course, here is to build trust and confidence in the vaccine, in our process to deliver it effectively, to deliver it equitably, and that is just as important, if not more important, than the logistical aspects of this. So with that in mind, several weeks ago, we stood up our vaccine distribution coalition. That group continues to grow and build, which is fantastic. We've had already some good preliminary discussions. We're having another full group meeting next week with that group. If you want to get involved, here's the contact info on the screen. You can reach out to us at that email address or via whatever other channels, social media or phone. And the goal here is to have really a diverse set of community leaders, especially in often underrepresented and marginalized communities across our county, to be able to understand the science behind the vaccine, the positives and the potential risks, to be able to really ask those hard questions on behalf of themselves and their communities, and then ultimately we hope come back and say, look, yep, this makes sense. You know me and you trust me, and I'm recommending that you do this, and here's how you do it, where you do it, when you do it. So what'll really be a whole of community effort to get this vaccine out there and to have everyone feel comfortable with it. So that work is also going on. I want to thank all the members of that coalition. As we head into the Christmas season, I know we just finished Hanukkah and the other holidays going on. Like probably many out there, especially with the demands of this year, we are a little bit late in getting our holiday cards out, but I do have a digital version that I wanted to share with all of you. Here's our soon-to-be printed and mailed holiday cards. And don't worry if you're late, you're not the only one. Rebecca and Theo and I are excited to have a very boring and kind of, solo holiday period. We're still figuring out exactly how we're going to keep a 17-month-old busy. But we know it will include some Zoom calls with the grandparents, probably Theo trying to rip ornaments and lights off the tree, and then, of course, getting to open the presents and all that good stuff. And also just to take a moment and appreciate on a deeper level what we've been through this year, to appreciate our family and all the families that have really gotten each other through this and been there for each other through this year. I think of our whole team, Ulster County, or our community as a big family, and we've seen so many stories this year of how interconnected we are, how what one of us does affects others, and mostly in a positive way. And I asked that everybody keep that in mind as you head into this period. We are ramping up once again Project Resilience, and that is happening. We continue to see donations come in for that, which is great, and we thank you for that. That will be used to get food to our seniors, programming and support for our youth and kids, and to support families struggling without jobs or with limited income. So we'll continue that through the holidays and into January. The only other thing that I wanted to give everybody the heads up that you're probably tracking, but just to be aware, there is another weather event coming at us as we head into Christmas Eve here and into Christmas Day tomorrow. The National Weather Service has issued both a flood watch and a wind advisory for Ulster County and for the region. We're expecting heavy rain starting this evening and into tomorrow. That combined with the heavy snowpack could lead to flash flooding along rivers and streams, and even to, in our more urban areas, some flooding. So we're preparing for that and urging everybody to prepare for that. Also, with wind advisory in place, we're expecting sustained winds of 15 to 25 miles an hour, gusts up to 50 miles an hour, which could cause trees to come down and possible power outages. We're coordinating with Central Hudson. I know they're prepared for that contingency. So there will be people continuing to work through the holidays behind the scenes to keep us healthy, to keep us safe, to keep us powered and fed and all those other things, to be delivering our packages and mail, all these essential frontline workers that have stepped up through the crisis, that stepped up every day even before the crisis. We'll end today's update by thanking you for what you're doing and what you're continuing to do and will do next year for us. We thank you. We'll start to, once we get the vaccines out and through that we got to figure out how to more formally honor all of our frontline heroes from this last year plus. We know the need is great, and as you head into the holidays, if you have needs for food or housing or just mental health support, other addiction recovery support, other needs, you can call our Recovery Service Center. That number is on the screen. It's 845-443-8888. We have our great team standing by there. I also want to thank special holiday thanks to Radio Kingston team. It's been almost a year doing this, which is crazy, and you've been there every day helping us get this message out, and also to Diane and Manuel for helping us get the message out. Thank you. Happy holidays to all of you. We will continue to do our updates next week on Tuesdays and Thursdays, so same time, and hopefully we'll have good news and positive news to report. In the meantime, enjoy your holidays, be mindful of others, be safe and healthy, and stay resilient, and we will see you on next Tuesday.